Smile, hello everyone. Now I'm going to start a course on pathophysiology of hypertension. So in this video, I'm going to give you a short intro about the topics which we are going to cover in this course. Let me share with you the PPT. Since it is a very important topic, so after doing this course, you will be able to understand the whole physiology and pathology of hypertension. And after that you'll be able to use whatever knowledge you have, either whether it is a correspondence system or six key or triaging, so you can able to understand the changes of energy in our body, what is the root cause of hypertension in each patient. So this course is going to be a very wonderful course for everyone, and these are the topics which we are going to discuss in this course. We will discuss the cardiac cycle, we will discuss the regulation of blood pressure, and then we will discuss the physiological factor that regulate the blood pressure, and what are the physiological factors, that is the cardiac output and total peripheral resistance, what are the factors which is going to alter the cardiac output, and what are the factors which is going to alter the peripheral resistance. Then the short-term control and long-term control, that is the short-term control is through neurological system, long-term control is through renin, angiotensin, aldosterone system, RAS system. Then we'll discuss about the pathophysiology of hypertension, the classification of hypertension, then the causes of essential and secondary hypertension, what are the complications of hypertension, and then we'll also understand how the diet, meditation, everything helps into controlling the hypertension. So in this course, we need to understand the cardiac cycle. Why cardiac cycle has been very important? Because see, the blood pressure, we know that it is 120 by 80 or whatever it is, upper is systolic, lower is diastolic. Then we have to understand what is systole and what is diastole. So systole is the contraction phase and diastole is the relaxation phase. So this is the whole cardiac cycle, and how this cardiac cycle happens, what happens during systole, what happens during diastole. If you can see, this is the atrium. When atrium is contracting, the ventricle is relaxing, and when ventricle is contracting, atrial relaxing. So that is when ventricle is going under the systole, atrial is going to the diastole. When atrial is going to the diastole, ventricle is going to the systole, and this whole cycle is finished in 0.8 second. So this whole cycle we need to understand. Why this is important to understand? Because during the whole cycle, this cardiac cycle, the amount of blood which is ejected from the left ventricle into the aorta, that determines the systolic pressure, and the amount of resistance in the peripheral artery, that determines the diastolic pressure. Because in cardiac cycle we will be able to understand that in which stage what happens during the cardiac cycle, and in the last ventricle cycle, the amount of blood which is filled from the atrium, then the ventricle starts to contract, and when the pressure reaches 120, then at that time the aortic valve opens and the blood is ejected from the left ventricle to the aorta, and the amount of blood which is ejected, that determines the systolic pressure. And then when blood is ejected from the ventricle to the aorta, the blood goes down, the blood pressure goes down in the ventricle, and then the pressure falls into the ventricle, and when it goes below 120, the aortic valve closes, and when aortic valve closes, the amount of pressure remains into the atrium, in the peripheral arteries, determines the diastolic pressure. So the BP is controlled by cardiac output and total peripheral resistance. So systole is controlled by cardiac output, and diastole is controlled, depends on the total peripheral resistance. So if someone's systolic blood pressure is high, then we can understand anywhere, because of any reason, the cardiac output is more. And if someone's diastolic pressure is high, that means their total peripheral resistance is high. Then we have to understand what are the factor which going to affect the cardiac output. So this cardiac this functioning of heart, when the blood is ejected from the heart, the amount of blood, that is called the blood volume, which is ejected from the left ventricle to the aorta, that is going to determine the cardiac output. Then we have to understand what are the factors which is going to influence the cardiac output. So cardiac output depends on the stroke volume and the heart rate. Then what is stroke volume? So stroke volume is the amount of blood which is pumped from the left ventricle to the aorta. That the amount of volume the blood is important. If amount stroke volume is more, then the cardiac output will be more, and if cardiac output is more, then the blood pressure will be more. Then what are the factors which determines the stroke volume? So stroke volume depends on the preload, contractibility, and afterload. The preload is the end diastolic volume. This you will understand in the cardiac cycle, the amount of blood which is left in the left ventricle, that is the preload, that is the end diastolic volume. If end diastolic volume is high, then ultimately stroke volume will be high, and if stroke volume will be high, then cardiac output will be high. Then in the same way, contractility, then afterload. Afterload is directly dependent on the peripheral resistance against which the left ventricle has to pump the blood. So these are the factors. Then we have to understand why preload will increase, how contractibility will change, and the afterload will change. That it depends on the blood volume and a lot of the factor which determines all these things. Then again the heart rate. If heart rate is high, then the cardiac output will be high. Then the blood pressure will be high. But in some case, when there is heart rate is high but the blood pressure is low. Why? Because then again it depends on the filling time. So in detail we are going to discuss that if someone's heart rate is low but heart rate is high but bp is low, then what are the factors which determines the blood pressure? So we are going to discuss everything in detail in this course. Okay. Then the total peripheral resistance, the genetics, the lifestyle, and food and obesity, everything is going to determine the blood volume, stroke volume, then cardiac output, and cardiac output will be more, than blood pressure will be more. And next is the total peripheral resistance, that the resistance in the arteries, that is going to determine the diastolic pressure. So this resistance will determine the diastolic pressure, and this resistance will be dependent on the contraction and dilatation of the vessels. If the blood vessels are constricted, if any drug is due to any drug, the blood vessels are constricted, or because of any neurological changes, or because of hormonal changes, there are some hormones which are going to affect the contractibility of the arteries and vessels. So if there is more contraction, ultimately the peripheral resistance will be more. And if peripheral resistance is more, then the diastolic pressure will be more. And if there is a dilatation, then the peripheral resistance is less, then the diastolic pressure will be less. So we have to understand what are the factors which affect the cardiac output, and what are the factors which affect the total peripheral resistance. And there are some hormones secreted from the kidney that is also going to affect the total peripheral resistance. So this all we are going to discuss. Then what is how the blood pressure is regulated? So blood pressure is regulated. There is two mechanisms. One is a short-term mechanism, and another is a long-term mechanism. What is the short-term mechanism? Short-term mechanism is controlled by the nervous system, and long-term mechanism is controlled by the RAS system, renin, angiotensin, aldosterone system. So we are going to discuss in detail. So little bit idea I'm going to give it in this video. See, there are baroreceptors in the aortic arteries and the carotid sinuses also, and they are mechanoreceptor as well as chemical receptor. If there is some change in the artery, say there is more volume, then there is more pressure on this artery, and the pressure is more, then they are sensitive nervous system. They see this. If there is more pressure, then the ninth cranial nerve, that is the glossopharyngeal nerve, will take the information to the nervous system, and through the 10th cranial nerve from the aortic baroreceptors, information will reach to the nervous system. And in the medulla oblongata, there is cardio regulatory center. So there are vasoconstrictor center also, and vasodilator center also, and there is cardio inhibitors also. So these cardio inhibitors will reduce the blood pressure, reduce the heart rate, and reduce the function of SA node. Like that, they will reduce the heart rate, contractility will reduce, the cardiac output will reduce, and then the blood pressure will reduce. So this we are going to discuss in the detail, that you will be able to understand that in medulla oblongata point, why we should not always use blue color. We should use green, because there are vasoconstrictor also, which are going to constrict the artery when the blood pressure is low, and there are vasodilator centers also when blood pressure is high. When blood pressure is high, they are going to dilate the blood pressure so that they can control the blood pressure. So like that, there are so in blood, in condition of low blood pressure also, and in condition of high blood pressure also, this center is going to affect the heart rate and contractibility of the blood pressure. So in this way, the nervous system plays a major role. So in correspondence system, we use spines also. So through we need to stimulate the spinal cord also, we need to stimulate the medulla oblongata, the nervous system. Sometimes we need to stimulate the correspondence point of carotid sinus also, and we should not stimulate both the side, because if the carotid sinus are stimulated, then it can reduce the heart rate, and if we stimulate the both side of the carotid sinus, it can cause the side effect also. It can reduce, if it can reduce the heart rate to a greater extent, then it can cause the side effect also. So we have to be very careful in case of blood pressure, that when high we have to use carotid sinus, when we have to use, and how we have to use the medulla oblongata point and spine, and everything we are going to discuss. And next is the very important thing is the kidney, the function of kidney, because kidney secretes renin. Okay, and this is a very important chemical which is secreted for renin when there is low blood pressure, when the blood pressure in the kidney is reduced. What are the factors which we are going to discuss? And then through the special cells of the kidney, the renin is secreted, and renin works on the angiotensin, which is already available in the blood, which is secreted from the liver. And this angiotensin, angiotensinogen, is converted into angiotensin 1 through the liver after the action of renin. And this angiotensin 1, when reaches to the lungs through the heart, then the blood vessels in the lungs, the endothelial cells in the blood vessels in the lungs, going to secrete, there is angiotensin converting enzyme, ACE. So angiotensin converting enzymes works on angiotensin 1, and the angiotensin 1 is converted into angiotensin 2. And this angiotensin 2 works on the kidney and to stimulate kidney to secrete aldosterone. And this aldosterone in the angiotensin 2 are the very strong vasoconstrictor. They can reduce, they can increase the vasoconstriction, and they can increase the blood pressure. So this angiotensin 2 works on the aldosterone, and this aldosterone works on the kidney, on the pituitary gland to secrete ADH secretion. It works on the smooth muscles, and it constrict the smooth muscles to cause the hypertension. It stimulates the hypothalamus to stimulate the thrush so that they can increase the water. They take water, and increase water will increase the volume, blood volume in the blood. If blood volume will increase, then cardiac output will increase, and if cardiac output will increase, then the blood pressure, systolic blood pressure will increase. So like that, this is everything we are going to discuss in this course. Then the salt, the relation between the salt, because the salt relation of salt is very much related with the function of the kidney. If the salt, the intake, the absorption of salt increases from the kidney, then with the salt, extra water will be absorbed, and more water will increase the blood volume. And if blood volume is more, then cardiac output is more. And if cardiac output is more, then the blood pressure will be more. So we are going to discuss why extra salt is going to increase the blood pressure, what are the mechanisms, this everything we are going to discuss in this course. Okay, and then after that we'll discuss the classification of hypertension. There is primary hypertension or essential hypertension, and then the secondary hypertension, then the cause of primary hypertension, what are the cause of the primary hypertension, what are the cause of secondary hypertension, what is the genetic cause of hypertension, and then the complication of hypertension, so that we can understand whether the problem is in the kidney, or problem is in the nervous system, or problem is in the diet. Then we can, if we can find out the root cause, then definitely we can easily control the blood pressure. So in this course, we are going to cover every topic related with hypertension. And after this course, you will be able to use your knowledge of energy to treat the patient in better way, because it is very important to know the cause of the hypertension, because sometime because of some medication pressure is high, sometimes because of our diet pressure is high, sometimes because of extra stimulation of nervous system, the pressure is high. So the treatment will depend on the cause, depending on the cause. So in this course, after attending this course, very easily you can understand the root cause of the patient, and very easily you'll be able to control the blood pressure. Okay, smile, thanks.